Dr. Logan Waddell is our speaker this morning. He treats conditions including balance impairments, frequent falls, joint pain, difficulty walking, vestibular rehab, and post-surgical rehabilitation. As a specialist in geriatric care, he provides comprehensive physical therapy care to optimize health in order to maintain a high quality of life. He has earned a certificate in LSVT BIG, treatment protocol for Parkinson's disease. He has experience in private practice, inpatient rehabilitation, and home care therapy. In addition to physical therapy services, Dr. Waddell provides individualized wellness programs to optimize life after rehabilitation is complete. Dr. Waddell works with patients in their homes through his position at Superior Care Plus, a home healthcare company. He also recently started his own outpatient practice, Superior Rehab and Balance Center. He's well known in our Parkinson's community. He has presented with us in the past, always well received, and we are eager to hear from Logan again this morning. Dr. Waddell, it's all yours.
Well, thank you. Thanks for taking time out of your day to listen to this presentation. I took a roundabout path to get into healthcare. I was talking a little bit earlier before some of you joined that my background was actually in engineering prior to this, but my family experienced several different healthcare conditions along the way. So my grandmother and aunt had multiple sclerosis, my uncle had Lou Gehrig's disease, and my grandfather had Parkinson's. And watching from an engineering perspective, some of the treatments for Parkinson's at the time seemed a little inefficient. I didn't really see him improving as much as I thought he could be. So I entered kind of into healthcare, and now I have a large emphasis in my practice with people with Parkinson's to try to help that. I am a board certified geriatric specialist, and as he mentioned, I'm also certified in an LSVT BIG treatment, which is a treatment that was designed around some of the Parkinson symptoms to help mobility and balance. So today I'm going to talk about the risk of falls and how to prevent it. So I'm going to share a PowerPoint with everyone. And if you have any questions, you can kind of put them in the chat box and we'll address them towards the end. So the main topic is just preventing and dealing with these falls. And as you mentioned, I do work for a home care agency. So Superior Care Plus is one of my primary sites I work for, where I do in-home therapy covered under insurance. And then I do own a private practice as well that was started a few years ago. So kind of the objective of today is to discuss what actually is happening with Parkinson's that's causing these falls to be more common. How do you know if you're at risk for these falls? And then once you know if you're at risk, how do we really minimize your risk for falling and improve your mobility? And who can you reach out to for additional help? So this may seem redundant and like common sense, but I always start by defining what is a fall. And it seems probably pretty silly, but every single session I see someone, I start the same way. I ask how they're doing, if they have any new concerns, and then I always ask if they have had a fall. And it never fails me that they will always say no initially, and then they will come back. Sorry, let me restart that. They will come back and discuss a fall that they did have that they're having pain from. And with that, I think it's important that we use the same definition of what is a fall. And so it's any time you're experiencing an unexpected change of position from standing to the ground, to the chair, to the bed. And a lot of people will say, well, I just bumped into the wall or I fell into my chair, so I didn't really fall to the ground. And I want to make sure that, and as a healthcare professional, we would consider that a fall. And that way, when you're talking to either a neurologist or your primary care, that you can appropriately describe that you did have a fall. Because one of the things we're always looking for is any kind of pattern with these falls. So if it's occurring when you're commonly getting in and out of your chair, is it occurring during turning? And that way we can really address the issue of what's going on. And so why do falls matter? It's really the main reason older adults lose their independence. About a third of the people over the age of 65 in general fall each year. This is terrible timing, but I actually had a fall over my kid's Power Wheels yesterday and got scraped up. So it happens to anyone. But 87% of all fractures that occur actually come from these falls. And one of the ones that always scares me in particular with my clients with Parkinson's is a hip fracture. And when people have multiple falls, you're at risk for any kind of bone fracture, but a hip fracture in particular, about 25% of those people remain in a nursing home long term. So it's a really scary thing to deal with and something we want to prevent. For Parkinson's in particular, there's a range of studies that show that anywhere between 38% and 87% of clients with Parkinson's will experience falls. The Parkinson's Disease Foundation will say that you're about twice as likely as someone your age to experience a fall. And then a meta-analysis of several different studies found that people that have fallen in the past are actually more likely to report a fall again in the future. So about 57% reoccurrence of falls. So with Parkinson's, there's a few common causes that we want to address and look at in particular. One is freezing. And if you don't know what freezing is, for some people with Parkinson's, they'll essentially get stuck where they feel like they cannot move. There's a few common pathways that this will occur. So if you're walking and you have a change in surface between like hardwood and carpet or carpet and tile, any kind of threshold that you're changing, sometimes that can induce a freezing episode. Another common place is narrow pathways or doorways in particular can cause this. And then also during turning, and this can be a dual task kind of purpose, is one, turning in general in open space might cause a freezing episode, or turning in order to go to sit may cause a freezing episode. And that might be more of your thinking of multitasking instead of focusing on standing and turning. Another common cause of people with falls is changes in position. And this can be twofold. So this can be you're getting up from a chair unsafely, so you're using momentum to stand quickly and you're not stable. Or it can be the change in position causes a change in blood pressure. So here in a moment, I'll talk about something called orthostatic hypotension. And what this means is just your blood pressure will change or drop when you go to standing sometimes. And that can cause you to feel weak and actually lose balance and fall. A really common thing we see with people with Parkinson's is either shorter steps or shuffling. And sometimes people are not always aware that they're shuffling, and they're told by loved ones or anyone around them that, hey, you're dragging your feet. A good way to tell on your own is simply look at your shoes. If you look at your shoes and you notice the tread in the front of your foot or your toes, it's actually more worn than the back or your heel, it's a good sign that you're dragging the front of your foot. And then the final common cause of falls is just not having a safe home environment or safe place where you're walking at. So if you have a lot of clutter, or if you have lights not around your house that are not always on, that is a common reason for falling there. So getting into the freezing episodes in particular, one of the large ways to minimize this is just be consistent with your medication. I see some clients that set alarms, and that's very helpful. So they take their medication at the same time every day. And that way you can kind of judge the best of your ability if you have on-off times. If you don't take your medication at a consistent time every day, it's harder to judge when you might have that off time. And that can sometimes increase your freezing episodes too, if you're delayed in getting it. Also, if you do have a tendency to experience freezing episodes, walking to some kind of rhythm, either music or using a metronome, can really help maintain strides and prevent that. So some people actually have metronomes on their phone that they can hear and listen to while they're walking, and that will help maintain a longer stride length and preventing those freezing episodes. And then the big thing is avoiding distraction. So multitasking is difficult for anyone. In particular, with Parkinson's, the cognitive component of having multiple things going on at once can sometimes cause to increase shuffling. And once someone starts shuffling, that can increase to freezing episodes, or what we call fascinating gait, which is where you would be essentially tipping forward while you're walking, where your head's out in front of your feet. Continuing to discuss freezing for a moment, if you are having a freezing episode, if someone's with you and they're trying to help you, advise them not to be pulling on you. So I see a lot of caregivers, once someone's stuck, they'll try to grab their arm and pull on their arm to get them moving again. That can actually cause a fall and cause increased instability. So it's very common to see that because you feel you're helping getting someone to move again. A better method to do this is actually put, one, if you can do it yourself, think of shifting laterally. So think from going from side to side instead of being pulled forward. Because if your feet are not moving and you're being pulled forward, that can cause a fall. If someone's helping you, what they can do is they can put their hands on the side of each of your hips and help that weight shift laterally. And if we think of freezing where you're stuck and you can't move, typically weight is pretty evenly distributed among both of your legs. And in order to take a step, in order to move from that position, it's actually jumping, right? So we don't want to jump, we want to actually take a step. In order to do that, we need to shift to one side so we could advance one leg. If you're still having difficulty, another strategy is if you're standing still, to start swinging your arms. So if you swing your arms, that can actually start a rhythmic motion where your foot will be able to match up with that too. Verbally prompting yourself. It may seem silly, but it works really well. Some people will do 1, 2, 1, 2 for each of their steps, or left, right, left, right. This has the exact same effect as a metronome, and it's just setting up sequencing and timing. And then one that I commonly use in therapy is either one, if we're practicing, I'll use like blue tape on the ground, or just trying to visualize an imaginary line to step over. So if you have a visual target where you're trying to hit with your foot, that can sometimes help with the freezing and actually advance your step. One of the big things that causes falls in people with Parkinson's is orthostatic hypotension. So this impacts about 1/3 of people with Parkinson's. And what this is a change in blood pressure when you're changing positions. So this can be going from sitting to standing, it may drop, or more significantly, if you go from lying down to standing, that's going to be your biggest drop. And these can be all over the place. So some people might have drops of just 10 points. I had one client where they would lie down, their blood pressure would hit almost 200 over 110, and they would stand and it would drop to 80 over 40. So sometimes these swings can be massive. And when you're experiencing these, this can really increase your unsteadiness. And paying attention to what you're feeling and informing your healthcare provider or your neurologist of your symptoms can really be beneficial. So I had a referral the other day from a doctor saying the patient was referred for weakness due to falls, or falls due to weakness. So they were thinking their legs were weak. And when I checked them out, their legs were actually really strong. But when we stood, the patient instantly said he was weak and couldn't stand anymore. So we checked his blood pressure, and it was actually due to the blood pressure changes. And so some of the symptoms you want to be looking out for are any kind of lightheadedness or dizziness and that occur immediately after standing or a few minutes after. If you are feeling weak or tired after standing, that's a good sign we want to be looking at your blood pressure and the changes in position. Some other symptoms are blurred vision or cognitive slowing. So with the cognitive slowing, the person experiencing the orthostatic hypotension may not be aware of it. Sorry, I just got kicked out for a moment. Apologize. So the person experiencing the cognitive slowing may not be fully aware that they are losing consciousness, but the person with them will see a blank stare. They won't be responding to questions typically, and that's a good sign that that person needs to take a seat in order to prevent from passing out. A common symptom as well is if they are complaining of a headache that's radiating into your shoulders. A common description of that is like coat hanger pain, where if like the hook was at the top of your head, the hanger is going down your shoulders into your back. That could be a sign that your blood pressure is dropping on you. So when is this most common? This is most common typically in the morning when you're first getting out of bed after you've been lying down for a long time. If you eat a really large meal, some of the blood that's going to help digest that meal is dedicated to that instead of movement. Sometimes if you're straining during urination or a bowel movement, that can cause orthostatic when you stand up. Drinking any kind of alcohol will also cause it. Hot weather, if you're thinking of doing a long distance walk and you have a history of this, just be careful you're going on a warm day. And also physical exercise. If you're doing something that's really strenuous on your legs, think of a lot of squats, your blood will actually pull in your legs and that can cause some symptoms. So things to be aware of there. In order to minimize this, There are medications and pharmaceuticals that you can discuss with your doctor, but some non-pharmaceutical methods would be drinking more fluids. So by drinking more water and stuff like that, you actually increase your blood volume, which will help stabilize and increase your blood pressure. If you're experiencing these symptoms first thing in the morning, this is where falls tend to be most common, is when you first wake up and you go out of bed, get out of bed to go to the bathroom or something. If you have a nice cold glass of water, think of a quarter to a half liter, and you drink it over 3 to 4 minutes, that will spike your blood pressure and help stabilize it. A big one, which I'll talk about at the end, is safe changes in position. A lot of times, since chairs are designed more like beds now where they're so deep, people always tend to use momentum to jump out of chairs. And when you're doing this, that's a sudden change in position, which can cause that blood pressure drop. You want to avoid standing still for a long period. If you are standing in the same spot for a long period for something, if standing in line, think of doing ankle pumps where you're going up and down on your toes a few times. That can help with blood flow. And then one that is hard to avoid is laying flat for a long time. So think of sleeping. And that's why our changes in blood pressure can be more drastic in the morning. So one of the ways to prevent that is actually get in a wedge that you can put under the head of your bed and actually prop up your head, and that will help stabilize some of that blood pressure issue. If you don't battle issues of high blood pressure, one of the things you can think of doing is increasing your salt intake, and that will help retain a little bit of fluid and pump up your blood pressure as well. And then elastic bands or elastic stockings. You want the kind that go all the way up your thigh instead of just stopping at your knee, or abdominal binders will help as well. And what that does is that just helps prevent blood from pulling in your legs. So when you change position, you actually don't have that significant drop. And then if you can, instead of eating 1 or 2 large meals a day, that's really going to dedicate a lot of blood to digest. If you eat several small meals throughout the day, that can help manage some of those orthostatic symptoms. If you are experiencing orthostatic hypotension, a few things you can do right away is toe raises. So think of in standing, you can hold onto a counter or your walker and go up and down on your toes several times. If you cross your legs and stand for a moment, sometimes that can spike your blood pressure. Think of tightening and loosening muscles like clenching your fists or your legs as well will get your muscles activating. If your dizziness persists and you start to feel unsteady or weak, go ahead and take a seat. Because you don't have much reaction time once those symptoms start occurring. And no matter how strong you are, if your blood pressure drops on you, you're not going to be able to recover from that. So go ahead and take a seat and you can cross your legs. If symptoms continue to get worse, lying down is the best option. If a caregiver or a loved one is with you and you start to feel lightheaded and there's no place to sit down, have them help get to sitting on the ground and then lay down and have your legs raised. So I've had several clients that have orthostatic that is unpredictable. And so I always use a gait belt, which is a cotton belt that goes around your waist that really gives a lot of control. You can get them off Amazon or wherever for about $10. You can help lower someone to the ground relatively quickly. And once you raise their legs, their blood pressure will stabilize and cognitively they'll improve right away. So things to consider there. So kind of a gross overview. Now that we kind of know about falls and some common causes, the thing that's preventing us from falling is balance. So what is balance? Balance is really kind of a complex multi-system function that's working together. So we have our motor system, our sensory, and then our brain will take in all this information and then create a right response, hopefully. So when we're talking about motor systems in regards to balance, we're talking about 2 things. We're talking about your musculoskeletal system and your neuromuscular system. So as far as your muscles working, we need to have the strength in order to move and respond to any kind of stimuli that's thrown us off balance. So strength is extremely important to maintain. And the positive news is if you're having difficulty walking or with balance, there's a ton of strengthening you can do in sitting and lying down that puts you at no risk for falls. And we know that if you have no other balance training and no other interventions, strengthening alone can typically reduce your fall risk by about 20%. So if you have no idea where to start, strengthening is a great foundation. If anyone's ever had physical therapy with me, they're probably annoyed by how much I talk about flexibility. So a few spots in particular are the calf and the front of your hips or your hip flexors. And why I tend to focus on those 2 in particular they will really change some of your balance recovery strategies and also your posture. So if you're sitting in a chair a lot throughout the day or lying in bed or really just the average person, your calf tends to get tight. And when your calf gets tight, what happens is your toe will actually point towards the ground in that sitting position. And when we stand, it will cause our knees to go backwards. So in order to prevent falling with a tight calf, what we do is you typically bend your knees and you lean forward. Well, that instantly throws off your balance where you have stooped posture because your center of gravity changes. So I have had patients with Parkinson's that will be unstable in standing. If they're not holding on, they'll have a tendency to fall backwards. The first thing I always address is flexibility in the calf. And if you get that stretched out, that can almost stop falling backwards right away if that's the issue. And then neuromuscular, this has to do with coordination of movement. So we need to have your brain actually functioning and working on those muscles we're trying to address. Sometimes a good example is when someone's getting in and out of bed. You can have a co-contraction of muscles. And what I mean by that is if you think of your arm with your bicep and your tricep, so the muscle on top and the back, sometimes someone's getting out of bed and they'll be pushing as hard as they can. They'll be really straining. But if I go to lift their hand, it's very easy to lift. And it's because sometimes with Parkinson's, it will be activating both of those muscles. And this can be the same in standing in your leg muscles. But you'll be fatiguing and straining, but your brain's actually not activating the correct muscle sequence there. So setting up motor patterns, working on different strengthening programs are a great way to address that. So with Parkinson's, with motor systems, a common symptom is bradykinesia, which is just simply slow movement. And how that impacts your balance is if you're reacting slowly, we can't prevent falls. Another common symptom we'll see is axial rigidity. And all this is you'll notice some stiffness and decreased flexibility in your neck and your trunk. And clinically, how we'll see this is if someone's walking, they will have reduced arm swing. So if you're noticing looking in a mirror or on tape or your loved one, if you see them walking and they're not swinging their arms, it's commonly because their trunk is stiff, which is a very common symptom, but exercise can address that and improve your balance. And then I already discussed a little bit about changes in center and gravity with posture. If your calves are tight and your hips are tight, it causes you to lean forward. Typically, if you're standing nice and tall, your center of gravity passes through your belly button and then perpendicular to that right through your waist. And as long as that is in between your feet, you'll be stable. So if you're leaning forward, kind of like a stereotypical Parkinson's posture, what that does is that moves the center of gravity in front of your feet. And that almost has you always falling forward. So you're always compensating for balance, which can be strenuous and increase your risk for falls. So the other major component of your balance system is your sensory. And this is kind of broken down into a few different parts as well. Your visual field, which I'll talk about how Parkinson's can affect that. Your vestibular system or your inner ear. This is a great opportunity for any kind of rehab or balance training. We can help compensate by training this system up. Somatosensory is just a fancy word of knowing where you are in space. So if you close your eye and you put your hand out, you know where you are. And how you would actually experience this in particular is if you close your eyes and you feel like you're swaying or on a boat, if you put your finger on any surface around you, you're going to start to feel increased stability. And so that's a system that can be trained up for balance as well. And then central processing simply means that your brain has to interpret all this data from touching and knowing where you are in space and interpret which muscle to activate. So I'll talk about balance recovery strategies here in a moment, and this is critically to be trained up in order to help prevent falls. So with Parkinson's, the impact on some of these sensory components, or some clients actually experience double vision or blurry vision and changes in kind of field of depth perception there. So if you are having double vision or diplopia, make sure your neurologist is aware of it. If you were experiencing it before you had Parkinson's, make sure you're following up with your optometrist. But there are things like neuro-optometrists that will, and some regular optometrists that can address this and actually prescribe prisms for your glasses if you do wear glasses, and that can help with some of the double vision, will help in your ability to scan the environment and improve your balance. And postural instability, this is a symptom of Parkinson's. Of sometimes your brain is interpreting where you are in spaces incorrectly. So some people, if I take a picture of them and show them, they feel like they're standing upright, but they're actually leaned forward. So retraining your brain of what actually vertical is an important aspect of therapy or any kind of exercise. And then the impact Parkinson's can also have is the decreased response time. So if you have stimuli like I'm falling, we need to be able to respond to that in time and prevent that fall. So there's a few different kinds of balance. Static balance. So think of this as if you're standing, just not holding on to anything. If you may have a little bit of sway, you may feel like you're on a boat. Think of that as static balance. Reactive balance is if someone bumps into you. So if you're walking and you hit an unexpected occurrence, like you trip on a sidewalk or if someone bumps you, that's kind of a reactive balance. And then finally, proactive balance is if think of putting away like clothes in a closet where you're leaning forward, you're reaching out and you're trying to hang something. So that is your body trying to be proactive and actually respond before a loss of balance occurs. So why does all this matter? Your body has natural responses to loss of balance. So we have 3 standard responses. And if something, and I'll show you videos of this here in a moment, but if you have any kind of slight loss of balance, your ankles help stabilize you. So think of this as you're standing still and you're trying to maintain balance. If you have any kind of sway, it's your ankle that's helping stabilize you. The next one that's a little more extreme is if you get knocked over or if you're reaching for something and lose balance. We call this a hip response. And this is a strategy to recover from that. And the most important one that I train in physical therapy often is a step response. And this is if you're walking and you lose balance, you trip on something, having that quick step to prevent a fall is important. So I'll play a very short video here in a moment, but if you're looking at my cursor, the gentleman on the left here, so their ankle is their pivot point here. And this is if you're standing, this is just using your ankle to go from backwards to forwards. And obviously that's a little more extreme than what most people can do, but this video will show a good depiction of that. So you can see him kind of sway forward and back here. And he's just using his ankle strategies in order to maintain balance. So that's a good one to work on. I'll play it one more time to help prevent a fall if you are standing in open space. So moving on to the next one is our hip strategies. And here's kind of a picture of that, if you lose balance forward or backwards, how to recover from that. And here is a quick video of someone utilizing those strategies as well. So you can see him kind of extend back as he falls backwards. And as he goes forward, he's using those hip strategies to prevent that loss of balance forward. So it's used for a little bit larger losses of balance, but also a strategy that can be trained. So it's important to note that, like I said, we all have these balance recovery strategies. These strategies reduce in intensity and response time with age. But the positive news is no matter what's going on, Parkinson's, other conditions, or age, these can all be retrained with intensive therapy. I don't have a great video for the stepping response. And this is typically the most important response to train up. This is if you're walking and you stub your toe, this is how you prevent a fall. And what you see is the person in the middle here, they're essentially taking a large step forward in order to prevent a loss of balance forward. And the key there is taking a large enough step to prevent that loss of balance. So if you've ever seen someone fall where they're taking a million little steps backwards until they hit the wall or a chair, that's what we're trying to avoid. So sometimes with Parkinson's, you will have a step response. It will just not be effective. And kind of my best example that I had very recently, about a month ago, I saw a woman in her mid-80s. And during an initial assessment, I always do a balance test, and perturbations is part of that. So I'm pushing and nudging to see how you respond naturally on different surfaces, carpet, foam. And when I pushed her on any surface, her body would essentially be stiff and she would just fall over. So I have a gait belt. I make sure she doesn't fall and get her back to the middle, but she had no balance recovery strategies. And this is relatively common for people with Parkinson's and as they age in general. With 1 month of intensive therapy for her in particular, I use the LSVT BIG program, but it can be trained in other methods as well. We ended that month. She was doing balance training from standing on a Bosu ball, which if you don't know what that is, it's kind of like a half circle balloon. It's very unstable. She was falling backwards over a 13-inch hurdle and stepping onto foam without a loss of balance, without a support. So in a short duration of time, you can really train your balance in order to prevent falls if you have the right interventions for it. So how do you know if you're at risk for falls? The key thing I want to point out as I'm talking about this is we should never accept falling to be normal. I saw a client, this is years back, but when he was referred to me by his nurse, he was falling close to 20 times a week. And he just fully accepted that that was a normal part of life with Parkinson's. And I want to make sure that people are aware that it's common to fall with Parkinson's, but we should never consider it normal. We really need to address what's causing that falls in particular and try to address that. Again, with that program, he ended up falling about 3 times in the next month following a month of intervention there. So you can really address and change that. But we need to be looking at multiple factors here. Many of which we've already talked about, is you need to be evaluated for your strength. If you have any kind of weakness, your response might not be fast or strong enough to prevent a fall. We need to be doing a gait analysis where we're looking at how you're stepping. Are you shuffling? Are you dragging your feet? Hitting with your toe first? Are you unstable sideways? Your neurologist needs to be discussing your medications and medication reactions and side effects to make sure there's no interactions there. If you are having any kind of dizziness or orthostatic hypotension, that needs to be addressed. Visual deficits need to be discussed with your optometrist or someone. If you have diplopia, that needs to be. And then a history of falls. I typically spend about 1.5 hours to 2 hours the first time meeting a patient. And one of the biggest history things I'm trying to gather is if they have a history of falls, is there any link or common connection? Is it during turning? Is it when they're standing? Is it getting in and out of bed? So whatever's causing that, that is a great starting point to figure out how to prevent future falls. And our goal is trying to prevent this vicious cycle. So people that have falls tend to become less active. And once they are less active, your balance actually will become more impaired because we're not challenging those systems. So certain things that will cause you to be at increased risk will be decreased flexibilities, particularly in your hips and your ankles, any kind of decreased strength. A great analysis that you can look up online, that if you're just measuring your walking speed, if you walk a certain distance and figure out how fast you're walking, you can compare that to people your age online. There's a standardized test that does that, and you can see if you tend to walk at a slower speed and you're taking shorter steps, that will actually categorize you as a fall risk. Parkinson's will impact your balance, coordination, and reflexes. These will all increase your risk for falling in general. So how you determine if you're at risk for falls is you need to have a thorough medical history review. You need to make sure any other medical conditions are addressed, your medications optimized by your neurologist for your Parkinson's, making sure there's no interaction. You need to be looking at your home environment, which I'll talk about here shortly, to make sure that is safe for you. And there's nothing that can be a mitigated risk factor where we get throw rugs out of the way or something along that. A really good balance test can determine what in particular for you is a challenging point and what needs to be worked on. And then we can determine fall risk by doing something called a timed up and go, which I'll mention on the next slide. Making sure your strength is up and our flexibility, which I already mentioned. So a timed up and go is a test most people can do on their own or with someone nearby. And it's simply getting up from a chair, walking 10 feet, turning, and coming back. And what this does, if that takes longer than 14 seconds, you're evaluated to be a fall risk. And this is a validated test for people with Parkinson's. So it's a very simple thing you can do yourself to see if you are at increased risk for falls. Another simple test you can do at home is getting up and down from a chair 5 times in a row. So this actually has the same cutoff time. If it takes longer than 14 seconds, then you are evaluated to be a fall risk with Parkinson's. As a clinician, one of the things we use is something called a Berg balance test. And this is really good at identifying people that do have a tendency to fall. And what this does is we look at different balance systems. So we'll stand with your feet apart, with your feet together, your eyes open, your eyes closed. We'll turn your head, your balance on one leg. We'll push you in different directions. And what this does is this really isolates all those balance systems we talked about before. So this we'll look at your somatosensory, your visual system, your vestibular, and your balance recovery strategy. So this gives a professional a really good idea of what they need to be working on in order to help prevent falls for you. So by addressing fall risk, we really need to be talking about multiple approaches. Your medication needs to be optimized. We need to increase physical activity. Think of guidelines, kind of general guidelines for everyone is strengthening about twice a week and about 180 minutes of aerobic activity. New Parkinson's guideline is saying about 2.5 hours a week of exercise. And this could be anything. So it's what I always tell people are find a program you're interested in, and that will make you more successful. If you hate seated exercises, that's not going to set you up for good success if you're told to do seated exercises. If you like yoga or if you like Tai Chi or boxing, those are great options to help challenge your balance and improve your mobility. As I said before, you need to be dressed in your home environment to make sure that's safe and having a thorough fall risk assessment. So some of the benefits of exercise, one, it will help reduce your risk of falling as your balance improves. You're going to improve your flexibility, strength, and endurance. Your cardiovascular health will improve. Yeah, it actually can help and release endorphins and decrease depression, which will help your mobility as well. And it can help reduce sleep disorders, which are extremely common with Parkinson's. So services, if you're looking at improving your balance, these are things that you can ask whoever you're working with if they include all these. So one, a good foundation, as I mentioned before, is starting with strengthening. We know by strengthening alone, you can reduce your fall risk by about 20%. You want to have a thorough balance assessment, and you want your balance program to be addressing those issues. You want someone looking at your functional activities. So what I mean by this is how are you getting up in and up from a chair? How are you getting in and out of a car? Up and down from bed. So all these activities, although they might seem mundane, can actually increase your risk for falls if you're compensating. You want someone that's going to focus on different types of balance. So you want some kind of vestibular training on top of dynamic balance. That way, no matter what situation you're put in, you're able to recover from it. Talking about the household here, we want to make sure our pathways are clear. So I mentioned earlier with freezing, we know that if you have really narrow spaces or doorways that are pushed up against furniture and you're having to squeeze through, that can increase your freezing episode. So we want to try to clear pathways as much as we can so it's safe. One that seems obvious that's not always done is make sure your floors are clean. Make sure there's nothing wet on the ground that you're stepping in and you're going to cause a fall. I despise throw rugs. Some people love them. I went in a house the other day that I think had 13 around the house. It terrifies me because they're such a big fall risk and they're easy to remove or secure down so you're not having an increased fall risk. Try to ask yourself, is it really necessary to have there? Another one that sounds very obvious, but I see all the time in home health is electrical cords or like internet cables through doorways. One, with Parkinson's, it will cause a threshold that can increase difficulty stepping through a doorway, and it's also a trip hazard. Making sure you have adequate lighting is really important to help reduce your fall risk. Home Depot, Amazon, any of those big box stores sell these wonderful motion sensing lights that you can put on the ground around your house in the hallways. If you need a lit path to your bathway as you walk, it will light up the floor, and that way you don't trip on it. It's really fantastic, and they're cheap. They're like $13 to $15 there. And then stairs, curbs. If you have any steps into your house, think of putting a grab bar in or a handrail. That can really help reduce your fall risk. So one of the things that I mentioned earlier that kind of ties back in was the orthostatic hypotension, but I also see people fall from this position from just using momentum. So most recliners and chairs are awfully designed now where they're way too deep to properly sit in, although they tend to be very comfortable. In order to get out of them, we want to think of a few steps. And this will work on any surface you can get up from. And if you have strength to stand on your own and stand and maintain balance, typically you can get up from a chair if you sequence it correctly. So typically the people I see use momentum to get up from chair. They'll rock forward and back, and then they'll kind of spring up. That's probably the most dangerous way to stand. And they're typically trying to do that from the back of their chair. And what you'll notice, if you or someone around you can look at that tell you if you're getting up properly, is simply look at your toes when you're trying to get up. If you go to stand and your toes are popping up, that means we need to improve how we're sequencing at transfer. And what that's showing is we're unsteady backwards. And a thing that people may notice is they may be stuck on their arms. So if they go to get up from a chair and they're pushing, they may be stuck like this and can't lean forward. So kind of proper sequencing is scooting all the way to the edge of your chair. And how I tell people they're far enough is if they look down in between their legs, if they can no longer see the chair surface, they're probably far enough on the edge. You want your feet back as close to the chair as you can get it. So the farther away you place your feet from the chair, it's actually causing you to depend more on your arms, which can make the transfer more difficult. And the most important one that you can practice is leaning forward. And you want to get comfortable to the point of leaning forward to your nose out over your toes. And what that will do is it'll maintain all the weight on your legs and help with that transfer. And then you'll be able to use your strength and pushing up on the arms if available to help complete that transfer. The other large fall risk for people, anyone in general, but people with Parkinson's, because it's kind of a dual task, is sitting down into a chair. So I see a lot of people as they're walking and get close to a chair, they're excited to sit and they'll turn and fall into the chair. And I always try to advise against this because you set yourself up for a risk of missing that chair. And so always think of the mindset of you want to be in control of your motion at all times. And we talked about dual task a little bit earlier. And so we don't want to be, what I'll commonly see is people will get to the chair, they'll reach for an armrest and start bending and twisting all at the same time. And what this does is it takes away your control. So try to stay as tall as you can until you're actually in proper position for a transfer. And what I mean by that is when you walk to a chair, think of turning all the way around. So both your legs are up against the chair and your butt's in the right direction. So when you sit, if you were to lose balance, you're definitely falling into that chair. We're not twisting and bending at the same time. And then we want to keep control. And how you do that is you can reach back with one or both hands, try to feel for that armrest or feel for the chair. And then the key to maintaining balance and not plopping into the chair is actually bending your knees and leaning forward. So we're trying to keep weight on your legs in order to prevent that fall into the chair backwards. So I want to talk about gait for a moment. And this is something that really needs to be addressed by someone that's looking at your gait in particular or what's going on. So I recommend consulting your neurologist or a physical therapist in order to be very particular about this. But a common symptom is shuffling with Parkinson's. And it's where someone's dragging their feet. You'll notice shorter steps at a slower pace. And if someone is with you, an improper cue I typically hear is pick up your feet. And that thinks of more of a marching motion. And then when you're marching, sometimes you hit very flat-footed or toe first when you put your foot down. And that's what we're trying to avoid, even though they're clear in their feet. A good cue or thing to think about is extending your stride. So if you take a really long stride, your tendency is to hit with your heel first, and then you're not going to catch it on any kind of surface, such as a sidewalk edge or anything you might trip on. So here's kind of a good side-by-side video of someone. Again, this is kind of an LSVT video, but this is applied to anyone that goes through any kind of gait training. And this is before and after therapy here. But I want you to notice a few things with someone's gait. So you kind of see that marching motion I was just talking about. And we see that he's hitting very flat-footed here. So his whole foot's hitting at once. So he's likely to catch his toe on something. He's using a cane here, but not really using a cane. He's more carrying it. And we saw some hesitation there with that change in surface we talked about. And the last thing we can notice here is the change in arm swing. So you notice very little arm swing with the steps. This is a guy that had about a month of therapy, and we can notice the change in his walking speed right away. His steps are much longer, which will be much safer, and his heel is hitting first, allowing his toe to clear any obstacle he may encounter. And by working on his back flexibility and maneuvering, you can actually see that he developed his arm swing back. So a quick kind of side-by-side comparison of potential that almost everyone has to improve, and which will lead to a much safer gait pattern. You'll see less hesitation with turning, getting in and out of vehicles with this, and it's just something to consider that longer stride will really decrease your fall risk there. So I want to talk about assistive devices real quick to wrap up, and this will be very short. If you do use a cane, if you are using a cane, proper sequencing is really important to actually make it useful. And if we're watching, we don't want to be matching our cane with the leg we're walking with. We want to be matching our cane with our opposite foot. So it's like a tripod effect. And that's really important because almost no one uses a cane properly if they just bought it from a store. If we're talking about other devices, such as a rollator or a walker, this is the one that I commonly suggest. Rollators are not safe for everyone, especially if you have a tendency to lean forward. They can roll away on you. But if you have been using a roller and you're having difficulty getting in and out of the car, this is a fantastic model because it folds in this way, which allows that to stay stable. So if you're opening your trunk, you don't have to worry about that falling over there. So this walker in particular is a wonderful recommendation. It doesn't do quite as well on uneven surfaces as the previous model I just showed you, but this was actually designed around Parkinson's. So it's a lot heavier. I think it's 20 to 30 pounds. And what that does is it makes it a lot more stable. So the risk of it tipping over if you lose balance is a lot less. The brake system on this is actually reversed as well. So it's the brakes are always locked, except when you squeeze, then you'll be able to move. So you always have a nice stable surface. And if someone has a history of freezing or difficulty advancing their step, one of the nice features that's available with this model is a sound mechanism, like a metronome, and a laser. So a laser will be pointed on the ground and actually will give you a benefit of taking longer strides there. So just to recap really quickly, exercise is an important regimen to start to include, consulting any kind of healthcare professional, such as a physical therapist, a personal trainer that's certified in power, boxing, or any other person you feel comfortable with is a great approach. Making sure your medications are optimized with your neurologist is important, making sure your home environment is safe. And then I always recommend consulting someone like a physical therapist so they can do a thorough balance assessment and figure out what's going on and how you can improve. The last thing I want to cover real quick before I open questions is if you do fall, what do you want to do? I just taught a guy the other day that was stuck on the ground and had to call 911 a few days in a row, how to get up off the ground in about 30 seconds when it took 15 minutes the first time. And the key is rolling onto your stomach first if you can. And these are all things that can be worked on with a physical therapist or things that you can work on in bed. It's just practicing rolling. And so rolling onto your stomach and crawling to a surface like a sturdy chair. And you want to get up on both knees from there. From there, you want to be leaning most of your weight on this chair and get up on one knee, and then continue leaning onto the chair and get that other foot up. Now, the most important part here is some people get really excited they're off the ground and then they stand really quick and they fall back down. So just be mindful of keeping your weight forward and maintain your stability there. But that is a fantastic method to get off the ground independently if you don't have any injury. Obviously, if you have any other issues, call 911 for assistance. So I went through a lot of things really quickly there, but if you have any questions, I'll look through the chat now and we'll try to answer them. So here's my contact information as well. That is our office number. You can always be transferred to my cell or you can send me an email. If for some reason I don't get back with you, I will be out of town starting next Saturday for 1 week. So I'll try to get back to anyone that does reach out though. So kind of looking at the chat here, it looks like posture, best practices to avoid slouching, slumping. Okay, so a few things. So the question was in the chat of just how to improve posture and avoiding slouching or slumping. This is kind of twofold. We need to focus where most people get tight is in their chest here. And what that will cause is a rounded shoulder where we're going forward and our head goes down. A great way to start stretching that is if someone can help you. If you get your arms like this and they pull back, that will open up your chest. Another great way to do that is in a corner or a doorway, and you can do the same stretch on your own there. So posture exercises such as strengthening your upper back is another great way to compensate for that. But cues also do help. Programs like LSVT and power moves, which are performed by a personal trainer, do address some posture exercises as well. Does anyone else have any questions at all?
If you have a question and you can't figure out where the chat is, please feel free to go ahead and unmute your mic and ask your question.
Thanks. How about walking on a walker?
As far as using a walker?
Yeah.
Well, it depends on the type of walker. So we went through two basic kinds in the beginning: a four-wheeled walker, maintaining safe distance, so you're not leaning onto it. You always want to think of your steps into the walker. When you look down, your foot should be hitting between the back wheels at least, and that will avoid leaning onto the walker to roll away. Another type of walker I didn't show is a front-wheeled walker, which is a silver walker with two wheels in the front and slides in the back. And the key with that one is maintaining the safe distance. So think of staying within that U shape. Do you have any questions in particular regards to the walker?
I do, Logan. I don't particularly like the last walker that you showed, that you just talked about, the aluminum one with the tennis balls.
Correct.
They're not very stable. But it seems like it's always the first type of walker people get.
Mm-hmm.
How can we change that?
So it is the most commonly prescribed walker initially, because the first thing we always consider is someone's ability to maintain control of a walker. So you'll see sometimes if you give someone a four-wheeled walker, what they'll do is they'll apply pressure anteriorly or forward, and then they have falls forward because as they push, the walker rolls away. Mm-hmm. And as far as controlling your gait speed and posture, the aluminum ones are better at that initially. You also see that most commonly referred in a nursing home or hospital because liability-wise, that's going to be the safest one. But you're right, it's not necessarily the best option for most people. And if you're taking it anywhere other than a nice smooth hallway or something, they're pretty difficult to walk with. So those middle walkers, the rollator, if you can control your posture, that is a good option because it works really well on uneven surfaces and even surfaces. And the U-step is by far the most stable, where it's very difficult to tip and it's a very stable surface.
The only problem is it's not very portable.
That's correct. So, and it's heavy. So if you're getting in and out of a car, you got to think of you're lifting 20 to 30 pounds every time you're doing it. So, but so insurance will help cover some of those walkers. You can write prescriptions for them. There's local companies like Mulaney's that now will actually deliver it to your home through insurance. So that's a good option. They just started carrying them. And so I typically recommend having insurance help pay for one of those. If you need the increased stability within your home, they're a great option. But if you need something that you're taking out of the house, something like that Nitro or a similar rollator is a great option to keep in your car where you're actually going places. Because on uneven terrain with those 6 tires and the smaller wheels, it's a lot more bumpy of a ride with the U-step.
The other thing is the U-step or insurance won't pay for the laser light on the U-step.
That is correct.
So that's an additional like $230, $40.
And I think a big thing also is to price it out. So consult your insurance to see what they're paying for, but you can also find them online for a little bit cheaper than you can from your typical medical supply store that might be increased by 20% or more. Like the Nitro, if you buy it from certain places, it might be close to $500, but you can get it online for $250. So,
Oh,
and
wow.
that's now, the Nitro is now a walker that the VA solely prescribes for rollators. So that is the primary one prescribed by the government.
Wow.
The general price of a U-step, I believe, is $480 if you're not going through insurance.
Yeah, something around there.
So with that, I will thank Dr. Waddell. This was an excellent presentation. I cannot wait to talk to a couple of my relatives about what's their balance recovery strategy. And because I'm pretty sure that a couple of folks close to me don't really have a strategy. So we're going to get them started. Thanks to everyone for giving us an hour on your Saturday morning. We'll look forward to seeing you again in September. Stay tuned again to parkinsoncincinnati.org for information on all of our upcoming events.